Hello everyone, I'm Bhagya, and over the years through my wellness journey and interactions with people across all ages, I've realized how we overlook things and affect our daily comfort and overall well-being, like allergies. One such condition is allergic rhinitis. It affects millions of people and yet is often misunderstood or left untreated. I'm excited to be here with Dr. Drhimanshuthakkar, an expert in respiratory and allergy related conditions. Our goal here today is to deepen patients' understanding of allergic rhinitis, its management and improving their everyday well-being. This discussion will lead to more accurate knowledge of respiratory care and allergic rhinitis. Doctor, to begin with, many people confuse a common cold with allergic rhinitis. Can you explain exactly what is allergic rhinitis and how is it different from the common cold?
Allergic rhinitis is a condition in which there are many allergens from the environment that goes inside the nose and patient gets allergic symptoms like itching in the nose, itching around the eyes, throat itching, and it leads to the severe running of the nose and sneezing. Many allergens are in the atmosphere like pollens, dust, and this leads to the allergic condition. While in case of the infection, there are no allergens, but patient is having complaining of nasal obstruction, stuffiness of the nose, and many a times patient gets nose block.
That's very helpful to know. My next question is, what are the typical symptoms and common triggers of allergic rhinitis? And how does it affect someone's quality of life?
There are many typical symptoms of the allergic rhinitis like running nose, burning and irritation in the throat, and irritation around the eye and inside the angle of the eye. When patient exposed to environmental allergens like dust, pollens, fumes, perfume sprays, that leads starting with the old symptoms and that leads to the severe running of the nose, nasal obstruction, and day-to-day life patient becomes more irritable and psychological disturbance may also happen and patient inability to sleep because of the allergic symptoms. So this leads to definitely performance disturbances in patients.
Thank you, doctor. It's clear that allergic rhinitis can very well impact someone's day-to-day life. So my next question is, how can allergic rhinitis be managed or treated effectively, especially for people with recurring symptoms?
In allergic rhinitis, patient requires immediate treatment to prevent the future complications. Like it should be treated with the medications like antihistaminics, corticosteroids, intranasal corticosteroids, and sometimes they may require oral steroids also. These parts are for medicines. Now prevention is better than cure. So in seasons, particularly of pollen season, they should have shut down their windows, and while traveling also they have to wear the mask to prevent allergen to enter in the nose. This leads to the prevention of allergy. So first line of treatment is to escape from the allergen, and that leads to the definite line of treatment with the medications they don't require also if they try to make themselves away from the allergens.
Thank you, doctor. That's so insightful. And my final question here is, are there any long-term complications if allergic rhinitis is left untreated?
If allergic rhinitis symptoms doesn't treated in time, this leads to sinus infection like chronic rhinosinusitis. It leads to nasal polyposis. In future, it leads to asthma also, and particularly patient's ability to work in performance also work performance decrease and inability to sleep properly. So there are cognitive dysfunctions and patient leads this leads to depression and anxiety in their life. So attention should be given to treat the symptoms as early as possible to prevent the future complications of allergic rhinitis.
Thank you so much, doctor, for sharing such important insights. I hope this discussion inspires clarity about allergic rhinitis and its impact on the quality of life. Take care of your respiratory health and please feel free to consult the doctor for further insights. Stay well and breathe easy.